And we are now live, Senators.
All right, good morning. This is Senate Health and Welfare. It is March 1st. And we are looking at several bills this morning. We're starting out with S56, the child care bill. And we have with us Joyce Manchester from Joint Fiscal, as Nolan is also here. Our Vice Counsel. We've been really very interested in looking at some of the numbers associated with the bill and what might be possible for us to recommend. I think this committee will probably be interested in looking at what will help children and families and child care centers to the greatest extent that we can. The final decisions on funding, of course, are going to be down the hall in finance and appropriation. So we have a role to play in the policy discussion, and then we'll see how it goes after that. So Joyce, thank you so much for being here.
Thank you. Good morning to everyone. My name is Joyce Manchester with the Joint Fiscal Office. I haven't met some of you, but I certainly know
Oh, no,
others
let's
of you.
do that. Thank you.
Okay.
Start right here.
I'm Senator Terry Williams from Rutland County.
Good to see you.
I'm
Yes.
Mark Hardy.
Hi.
Hi. Hi, I'm Martine Hewitt from Chittenden Central.
Dave Weeks, Rutland County.
Very good. Thank you.
Jenny Lyons.
Yes. Thank you very much. So my job today is to talk to you about the share of family income that goes to early care and education. Alex, I am not yet able to share my screen. Is that true?
You should be able to.
Share screen. That's the one I want. It's not.
There you go.
No. It's the yellow one. Oh. Okay. Good. So I hope you will ask questions as we go through the slides. The first slide is simply explaining what it is that I'm trying to do. You will see that I'll be talking about the CCFAP, the Child Care Financial Assistance Program run by the state of Vermont. And the current way that it operates is that families with income above 150% of the federal poverty level are expected to pay some or all of early care and education tuition. I'm calling it tuition. It's the payment that you make in order to access those early care and education services. So families with income up to 150% of the federal poverty level currently have no copay. So CCFAP makes the full payment to the child care center, early care and education center. Families with income just above 150% and up to 175% pay $25 per week, okay? So it's important to realize that that's a flat dollar amount. And even as their incomes are increasing from 150% up to 175%, the dollar amount that that family pays stays at $25. So in a minute, I'm going to be showing you some charts, graphs, in which you will see that at 150%, just above 150%, the family is paying so much of income, and then that's going to decline as that income grows, right? Because the dollar amount stays the same, the income is growing, okay? So, and then we move to the next notch, which happens at 175% of the federal poverty level. And those families pay $50 a week. And again, you'll see it's high and then it drops down as income grows, okay? So for every 25% increment for FPL, we're adding another $25 per week to the family's contribution. So that's the way it works. The CCFAP subsidy currently ends at 350% of the FPL. And that's the cliff or the slope or whatever you want to call it that lots of people are talking about, right? Once you get up to 350%, there is no more subsidy. Families are paying the market rate for early care and education. Okay, and how much is CCFAP reimbursing the early care and education center? Well, the top rate right now for 5-star center-based care is $17,430. So that is the amount, that's per year full-time care. So that's the amount, 17,430, that I'm going to assume families would be paying if they had to pay out of pocket, okay? Now, it's very possible that some centers charge more or less
That's per child?
per child, yes. And that's an average across ages 0 to 4. I'm calling it 0 to 4, even though there may be some 5-year-olds who are not yet. Right. Okay, so 17,430. And just for context, you might recall that in the RAND report, they suggested that high quality accessible childcare for ages 0 to 4 on average would be about 28,000. So I'm going to be looking at 17,430, but keep in the back of your mind that if we were compensating workers similar to the way the public school teachers are compensated, if we had all of those high quality features available in early childhood centers, the cost would be significantly higher, okay? All right, so let's take a look at one of these charts or figures. And I really need you to understand this because I'm going to be showing various options. And so if you understand the first one, we'll be in good shape, okay? So the first thing to know is that I'm going to focus first on a family of 3. You probably know that the federal poverty level depends on the size of the family, okay? So the federal poverty level, oh, and I should also admit right up front that I'm using the 2022 levels because I started doing this analysis back before the 2023 levels were available. At some point I will update. So in 2022, the federal poverty level, the 100% level for a family of 3 was $23,000 and something, $30, right? So you can see I've labeled a few of these family income levels along the x-axis, the horizontal axis. You can see the 200% there is at 46,060. So that's twice the federal poverty level for a family of 3. And you can sort of tell that my line starts at 0 because families at 150% or less are not paying anything for childcare. At the 150% level, that payment jumps to $1,300. That's $25 a week for 52 weeks. So I'm assuming full-time care, $1,300 for a family just above, $1 above the 150% level, okay? And then as that income for the family of 3 increases a little bit, the share of their income that is $1,300 is dropping. So that's why the zigzag goes down, right? We have a notch downward. And then I get to 175%, and all of a sudden the family is expected to pay $2,600, right? $50 times 52 weeks. Okay, so that explains the zigzag. Is everyone good with that? Okay, so that's the zigzag, which stops currently at 350% of poverty, where the subsidy stops. So that's the bottom of the zigzag. And then we have the slope or the cliff that goes straight up because a family with $1 of income over 350% is expected to pay the full price themselves. Subsidy stops. Okay, and
Can I make a
Sure.
comment? So I'm fortunate enough to have this right here next to me. And the family of 3 at 200% of poverty is close to $50,000.
in 2023,
Yeah.
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 So all of these incomes have gone up a bit.
Yeah.
Right. Right, okay, good. So yes, so we have this vertical, almost vertical line, very close to vertical line that goes up right at 350%. And then it's simply a matter of looking at $17,430, the price of full-time, full-year care relative to incomes, right? And that's going to be a decreasing percentage as the income moves out. You'll also notice on this figure that I have placed a light dotted line at the 10% level because the legislation did state that families should not be expected to pay more than 10% of their income. And you can see even under the status quo, many families, those are above about 250%, are paying more than 10%.
This is the full-time.
Full-time, full year Yes, absolutely. And some families use less than full-time, full year. Yes,
But you're only taking into consideration CCFAP, you're not taking
Absolutely.
into consideration tax credits or
Exactly.
other assistance they may be getting.
Exactly.
Or childcare payments.
yes, because that then gets into family size and their other circumstances and so forth. So this is only CCFAP, exactly right.
So if I could, it's a good point. Is there a point where you overlay that onto this kind of data to show, you know, it is a cumulative benefit?
Right.
Is it ever combined to show us?
So I have not done that. There are complications. So for example, CCFAP considers a family of 2 to be the same as a family of 3. So I'm showing you the family of 3, but in fact, if there's a single mom and 1 child, they would also qualify under these same income levels, okay? So some of the families that would belong to this graph might have 1 child, 1 parent. Some could have 2 children, 1 parent. Some could have 1 parent, I'm sorry, 2 parents, 1 child, right? So assigning the child tax credit would be, I'd have to take some average of something or other, right?
It's not just the child tax credit, there are federal child care tax credits.
The child dependent care credit,
Yeah,
right?
yeah.
Yeah, and that would depend on the number of kids as well and how much time there's in here, or childcare, I should say. Yes,
Yeah,
absolutely.
I haven't read it for a few weeks, but the RAND study does try to integrate that, don't
Oh,
they?
well, I mean, they acknowledge that certainly, and they recognize that that's helping families. I don't think it's.
It's not in their
It's
chart.
not
They
in
didn't do it, they didn't model it.
Yeah, I asked them to model that. I've talked to them several times because I think it's missing a piece of the pie when we're not taking that.
So they do take that into consideration when they think about the resources that are going to pay for,
The overall
Yeah.
resources,
Yeah.
okay.
so those are resources that are currently going into the system that could be reallocated or.
Right.
Okay, any other questions about this one? Okay, so the question is, looking at this CCFAP chart, what might we think about to ameliorate, shall I say, that steep line, the steep slope that heads up north from 350% of the federal poverty line, right? Okay, so here's one simple attempt. Suppose we said, okay, we think that limiting families to 10% of their income for early care might be too much, might be too expensive. Could we limit families to 15%? And so the blue dashed line here shows you what it would look like if you simply cut off family contribution at 15%. So you can see that it's helping families up to about 500% of the poverty 5 times. 23,000, which is what, 115,000 in my old numbers. Probably 125,000 in the new numbers, something like that. Okay, so that's one approach. Now, when it comes to implementing such a policy, that's tough because it says that you need to know what is the family's income, and you need to peg the family contribution to 15% of that. And oftentimes family incomes are moving over time and so forth. So then you could say, well, we could peg it to last year's household income, right? Just take last year's household income, 15%, that's their contribution, CCFAP pays the rest. Of course, the problem there is that circumstances change, and how would you adjust for that? So there are implementation questions involved in pegging a percentage of income. Some of those are also involved, of course, in the current CCFAP payment schedule because, between this band, 150% and 175%, the family is expected to pay $1,300. So if the household income is moving, they might be moving into a different band of dollar amounts. So anyway, so there are considerations involved here. Okay, that's one approach. A second approach might be to extend the range of the CCFAP payments. So this shows you what happens I'm still using $17,430 as the cost of early care and education. I've simply moved the cutoff point for CCFAP from 350% as high as it takes so that families start paying the CCFAP contribution doesn't get to be greater than the cost of care, right? The early care payment by families doesn't surpass the cost of care, right? So at some point, families are paying so much, even with the subsidy, that they're getting close to 17,430, at which point CCFAP subsidy goes away and they're just paying the cost of care, and we're back on that downward sloping curve, okay? So in this case, using 17,430, the CCFAP subsidy would stop at 475%, right? Now, if the cost of care went up, you would see that point move out, right? Because there'd be more to pay for, so more possibility for CCFAP subsidies. Is that clear? Okay.
Very clear. Just to, maybe a teaser question. Are you also plotting this out at 28,000?
Let's see what comes next. Okay, unfortunately, I cannot see. How can I see the top of my screen?
Oh, you can do that around.
How can I get rid of this stuff up here? What did you do? I need Nolan with me at all times.
Oh, I see.
You know what? I've got it printed out. That we don't have to spend time on this.
Oops.
Good to know which chart I'm talking about. Able to just drag the.
I was trying to do that, but I couldn't.
Yeah.
Whoa,
It looks good up there.
There we go.
Look at that. Oh, perfect.
You don't need me, you need them.
Okay, so I'm now using $28,100, which is the average cost of high quality care according to the RAND report for ages 0 to 4. At this point, it might be a good idea for me to say that if child early care education centers were to charge infant prices for infants and 3 and 4-year-old prices for 3 and 4-year-olds, the infant price would get to be much bigger, right? It's like $35,000 for high quality infant care. And the reason is that the ratio of students per teacher has to be 4 to 1 for 0-year-olds and 1-year-olds, right? So it takes a lot more personnel to be with those infants and early toddlers. Okay, but here, I'm just trying to illustrate that if we move to high quality care, we reimburse at the cost of care, and if I use the average for ages 0 to 4, then the amount per year for a full-time student would be $28,100. And you can see that all of a sudden, the share of family income skyrockets at 350% up to 35% of income for a family of 3. So this is the middle part of the income distribution that you worry about when you think about raising the cost of care and reimbursing at the cost of care. Okay, so yes. So we have the same zigzag going up to 350%, and then we have a big spike topping out at 35% before it declines again gradually. Any questions about that one? Okay. So here I've extended the CCFAP $25 per 25% of FPL up to 500% of the property level. So that's just a way of showing you that extending that subsidy out to 500% really cuts the size of that benefit slope, so that the family at 500%, just over 500% of federal poverty, would be paying a little over 24% of their income.
And for 2023, that's 124,000.
124,000 for a family of 3 or 2, right?
Or two.
Yeah. Okay. So that's what we're looking at. Here I just decided to give you a table with actual numbers so that if you want to look at percent of poverty, again, I'm focusing on the family size of 3 with 1 child in care. But if you want to look at 2022 federal poverty levels relative to family payments, this is how the system works. So again, we earlier saw that chart where the share of income, stop CCFAP at 350% using 17,000 as the cost of care, then you get the 21, almost 22% share of income. And the jump up goes from 13.2% at 300% up to almost 22% at 350%.
Did you sort out how much per week would need to be put into CCFAP to get some of these folks lower as a percent of income?
So I would need to work with the Child Development Division to get the to get the numbers of kids, and what's really not clear to me is how many are using full-time care versus part-time care, all that
all
sort
of
of thing.
that.
Right, it's so detailed. Yeah, I mean, I have an idea that 60% of children ages 0 to 4 are under 350%, and 81% of children ages 0 to 4 are under 500%.
Say that again.
So 60% of children ages 0 to 4 are in families with income 350% of poverty or less.
Okay.
And 81% of families, 81% of children ages 0 to 4 are in families with incomes of 500% of poverty or less. And CCFAP is saying that participation in CCFAP right now is about 30% of eligible children. And prior to the pandemic, it was closer to 50% of eligible children. So between changes in the workforce and lack of childcare availability, there's been a drop off in the number of children who use CCFAP. This is it's part of what's behind the governor's proposal to spend more money on CCFAP in order to expand the families who can use it. But of course, if you don't do something on the supply side, you're not going to have more children using early care education. And the supply side is going to require the increases in compensation and support for early care centers.
Do you have a question? No.
Okay,
Just amusing.
Huh?
Just
amusing.
amusing, that's not.
Oh, well, that's okay.
Okay, so I've been talking about panel 1, where CCFAP stops at 350% of poverty, but panel 2 at the bottom of this slide shows the cutoff point if you stop at 400% of the federal poverty level. And you can see there that the family share would top out at 18.9%. So you're cutting from 21.6% down to 18.9%.
Well, it's also interesting, the panel 1, if you go to 400% up there, you're going to 18.9.
Exactly. So I'm just continuing up
Okay,
until I
just
hit that
putting-
line.
Yeah, got it.
Right. And I thought about just having one panel and saying that in words, but I thought it might be more clear to actually spell it out here. Okay, and then I continue this little exercise. Panel 3 on the next slide shows you that if you continue CCFAP until 450%, then the family would be paying 16.8%. And as we saw before, it doesn't pay to keep going to 500% because the family's already paying the full cost of care. So then there would be no spike, right? Okay, so we're almost at the end of my presentation. I have one more slide to show you. And this is for a family of 4, just to show that it does make a difference. So now I'm using the federal poverty level for a family of 4, which was 27,750, and it's probably now closer to $30,000, right? So, so you can see here that the spike ends at about, what is that, 18% of the federal poverty level. So because the family of 4 with 1 child in care has a higher income, but gets the same $25 per week payment, right? That's gonna be a smaller proportion of their larger income, at 150 or 350 or whatever income level, okay? So that's just an example to show you how the family size does matter. One fact about CCFAP that I've neglected to mention is that CCFAP caps the family contribution regardless of the number of children. I should say CCFAP caps the provision to families regardless of the number of children. So even with 2 children in care.
Can I stop you for just a
Sure.
second? Is that on, Sarah? It's really hot and there are a lot of people in here. It's getting a little uncomfortable.
You want it up higher? You can do that.
Well, I don't know if we'll be able to hear Joyce, but it's also really hot.
That's true.
Joyce has a good alto voice.
Always.
How does that feel on one of those?
I don't, sent her, that probably isn't gonna do a thing, but we can try.
Well, it's just hot in here as well.
Yeah. Oh, I'm comfortable.
Okay, so let me just finish that thought. So CCFAP expects the family to pay the same amount, whether they have 1, 2, or 3 children in care. However, CCFAP reimburses the early care provider double the amount if there are 2 children from, in other words, CCFAP pays per child.
Yeah.
To the provider, even though the family is only paying the same amount. That makes sense?
Want to please say it again, just so that, okay. Yeah, it doesn't hurt to be repetitious.
Sure, shall I say it one more time?
Sure.
So the CCFAP expects the family to pay a set amount per week for early care and education, regardless of the number of children. So family of, or just over 150% would pay $25, whether they have $25 per week, whether they have 1 or 2 or 3 children. But CCFAP is paying an amount, almost $17,430, right? Minus $1,300, $2,600 approximately. So they're paying per child to the early care provider.
Okay.
All right, good, thank you.
Okay, now here, I think. First questions,
Yes,
any questions? A lot of questions. Would you mind doing something, I know you're gonna love this suggestion, but going through this one more time, quickly, just reminding us of everything that's there on the slides, because you said a lot, you had a lot of information that wasn't directly on the slides, so it would be extremely helpful, I think, just to go through it one more time, and especially for folks who haven't been involved with this in previous years. So,
sure,
is that okay?
that's fine, and please,
Yeah, let's do that.
yeah, and please ask questions, because it's, different people think different ways, so it's hard to know what's missing from your thoughts. Okay, so here we are talking about the family's contribution as a share of their income. And we're talking about the child care financial assistance program subsidies, which subsidize families fully up to 150% of poverty, and then a sliding scale, $25 per week, increasing at multiples of $25 per week as you move up the family poverty, a federal poverty level scale. Okay. So let's see, currently CCFAP ends at 350%. And I'm using the 5-star reimbursement for childcare centers, 17,430.
If
That's,
you were to use something at a 2-star level, what would that have?
I can't tell you off that.
Or,
Somebody know the reimbursement for childcare centers at the 2-star level?
Give me just a minute.
or a center that's not a star.
Yes, so, and there are also home-based care facilities,
Yes.
right, that would be at a lower level.
Right. So this would be the highest level that
Yes,
one would see.
yes. And in the back of my head, I have the governor's proposal to reimburse every center-based care facility at the 5-star level. The thinking is that rural facilities may be at a disadvantage. They can't get up to the higher quality level. They're being reimbursed less. The other side of the argument is that you want those centers to be incentivized to increase their quality. And so maybe it is a good idea to differentiate.
It's catch-22 because if
Yes.
you provide more resources, then maybe they can.
Maybe they can. But there's no hook to say if you're not
Yeah.
providing more resources. Right. Exactly. Coming.
That's okay, but
I'm almost there.
Okay, you can just interrupt.
Okay, I will absolutely do that.
Okay, so remember, here's the first chart that shows the status quo. So this is what's happening now based on the current reimbursement for early care centers at 17,430. And you can see no payment up to 150% of FPL. And then right at 350%, if you're $1 over that, if your income is $1 over 350%, you're paying the full cost of care yourself. And so that share jumps up to about 22%. And again, you can see where the line is at 10% of income. So we have many families between 250% and about 750% who are paying more than 10% of income at these prices. So here's one idea. Cap.
go ahead. I'm just drawing the one.
Oh, you're trying, okay. Cap the family income share at 15%, and you can see that would help those families between 350 and 500% of poverty. So that's one idea. A second idea would be to continue the CCFAP subsidy schedule as far as it takes. In this case, it's 475%. And at that point, you intersect the full cost, full price paid by the family as share of income would be less. So you're on that downward slope again.
Questions on this one? Because it's sort of attenuates that.
I mean, I would just want to note that the bill goes up to 450. And I mean, you know this because we talked about moving it up again, but we can't, you know, we were trying to gradually move it up and we can't go beyond 2 years of the bill because we can't find a future
Right,
legislature.
right.
So that's why it stopped at 450, knowing that the sort of cutoff point was between 475 and 500-ish.
Yes,
Before you raise the cost of care.
Yes.
Yeah.
exactly.
So we were very aware of this
Great.
scenario, but we just couldn't go further. And so it was either just jump all the way up or try to do it gradually. So
I'll share my musing, which is just that, I'm sure there are other countries, and I know we're not talking about how to pay for this yet, but I would imagine there are countries where the wealthier folks are paying a higher cost to help defray the costs of the lower income. This is the cost.
And in fact, that may be happening here if CCFAP is only reimbursing up to, let's say, 17,430, and the actual cost of care is, let's say, $19,000, right? Then the early care and education center might have no choice other than to charge the higher price for the families that pay full freight, right? So it's quite possible it's happening here.
G-Star program based on age.
2-star,
So it varies.
Right, okay, so multiply by 52 weeks. What is that? Can't do that math in my head. Okay. Yes, so here we have an illustration of what happens to the CCFAP schedule if the actual cost of care is $28,100 per year, based on status quo CCFAP. And you can see that the family at 350% of poverty plus $1 just over that line would look at 35% of income, which seems like a lot. Okay, for average cost of care is 0 to 4. Okay, and here we have, here I've extended the schedule for CCFAP up to 500% of poverty. And you can see that the family share drops down to more than 24%, less than 25%. So quite a significant drop there.
Okay, and you could draw the line across,
Yes, there's a
Here.
line at 10%.
you could draw the line across here to,
At 15% or whatever. Right, right. Absolutely. Yes, and of course, you recognize that the space under the line down to the 15% line or whatever level you choose is the amount that CCFAP would have to reimburse per child. Okay, and here's the fine schedule, which goes up by 50% of FPL. And it shows you how high that steep slope goes, stopping CCFAP at various levels. And then finally, we looked at the 4-person family, which could be 1 adult and 3 kids, or it could be 2 adults and 2 kids. And this is 1 child in care, but as I said, the expected family payment up to 350% would be the same under CCFAP. Of course, the spike, if the family has 2 children in care, the spike would be double because that family would have to pay full freight for the 2 children in care, right? A little bit daunting. They're currently at what, 18%? It would be 35, 36%. A lot.
I won't tell you what I pay per child here.
Yes. I remember those days well. All right. So any final questions?
So I do have a question, but other folks, any questions here for Joyce? It's really totally what, so the decision around where to begin and where to end and how to attenuate that cliff it is dependent on the resources that we have to invest. So the government made a proposal, and we and here would like to make a policy proposal that will help families, and then see how the resources can be identified now involved, not without conversation. So this is really very helpful. My question is, right now you've got it at 150. And so the bill suggests 185.
Yes.
Is there any modeling on what that would just push things up, over? How is that going to work?
So
Just a ballpark.
I guess the question is, would the family contribution be $25 per week, 185 to 200, or would it be
Yeah.
$50 per week? Because 185
Would
is
have
in
to
the
change,
range
wouldn't it? Yeah.
of $50 per week, right? So.
So if it were $25 a week,
And the schedule would just
it
go
would
over.
just slide over. If we're $50 a week, it would
You would
go less than slide.
stay at 0 longer and then jump up to the
Yeah.
second notch there.
Okay.
Yeah, we didn't specify in the bill.
Yeah,
Yeah.
we did not find that. But it's something that we could
So they-
think about, and that.
And the cost would be very different,
Yeah.
right? Actually, I don't know how many families are between 150 and 185, so I don't know how big that cost would be. But if you moved the CCFAP schedule over, that would add significant cost.
So you didn't do a chart that shows what's in the bill? You didn't model out what's in the bill, why not?
I've been working so hard to figure out how to draw these charts.
She's been working really hard.
I'm not doubting you're not working hard, I'm just saying that what's in the bill is not.
Right, so I haven't done that.
That may happen going forward.
It may happen
So
going
but
forward.
if it's $25 a week, everything would just slide over. As it is here, you can almost predict where it's gonna be,
Yes.
but at $50 a week, it would
It would just take out the first notch, you'd be at
take
zero
out the first
longer,
notch and then
have the same
go after
schedule.
that, but still sliding. Yeah, okay, makes sense.
The bill takes away the stars too, right? Wasn't it? The stars program?
Oh, the stars, that's exactly what Joyce was talking about earlier, where the stars would be under consideration, these are flat. The flat fee at 17,430 would be available for all CCFAP.
So I think once the determination is made, whether the CCFAP schedule moves over or whether you're just jumping up to 185 on the same schedule, it would be not a problem to put that on this chart.
Yeah. Any questions? Keep going. Nolan, did you want to add in to any here? Joyce has been very helpful. Good. It's going to be our decision about what level to recommend, just knowing what the schedule looks like over here for 2023. Anything else that, I'm looking at Miranda, did you want to make any comment or have questions while we're all in the room together?
I can just note that you had asked about the 2-star reimbursement rate. So
Yeah.
for an infant, the state pays $15,444. For a toddler, the state pays on behalf of a family $14,612. And for a pre-K age student, we pay $14,560.
That would be, can we get that, I mean, just so we know, have a comparative list of.
Absolutely.
Yeah. Thank you. Is there anyone else in the room? I mean, we're all sitting here together, so if you have questions of Joyce, Sarah, or Katerina, others, Katie. Katie, do you have any questions?
Any questions?
Okay, thank you.
Thank you. I'm going to go back to my office, but no one can text me if something comes up.
Okay, yeah, a lot of good work, and we appreciate the time you've taken to bring it to us. Very good. Yeah,
Thanks.
good. And we can imagine the shift to 185. If we'll keep it at 25, and then we just move the numbers on the ordinance.
That's right. Over, right.
Okay. So then you want that.
When this goes over to the finance folks, we make a recommendation as to which scenario.
Which levels, right, so we can stick with 150 or move to 185. We can make a decision that the people who have salaries of X amount based on, the federal poverty level should be receiving a higher CCFAP. So, and the one thing that we have heard, and I think the finance committee has also heard, is how to soften the cliff. So what we've seen today helps us understand what that means in terms of, the cutoff at 500% or 600%, and what does it mean for people beyond that. So we'll have that discussion. What I'm going to ask you to do is so look at the information that Joyce has brought us tomorrow. We also have time on S56, and what we'll try to do is we'll work with Katie today to go through the bill a little bit, and we'll start to try to make some decisions about these things. And I think give yourself a little bit of time to look at the graphs that Joyce has brought, think about look at this again, the federal poverty level, and make your own thinking. So, okay.
Like some of these scenarios, we can almost throw out if we really want to avoid that.
Yeah, so, right, the cliff is a problem. That's a huge problem. Only fair to people. The more we can soften that blow. All right, so Katie, you are here.
The only thing I would add to that is,
Nolan, please.
sorry, so she did this current CCFAP and then she used the 28,000 rand number.
Yeah,
Your cost of care will probably be somewhere in the middle depending on what you decide.
can you say that again?
So she's using the relative against the 17,000, which is the current. It sounds like the 28,000 rand report. So your decision of how the slope looks depends on what the new cost of care is.
Exactly.
That's what will decide the slope. So you have to decide just what your value for cost of care is going to be, as well as your subsidy if you're trying to think about the slope. That makes sense?
Yeah, no, that makes lots of sense. And that's one of the things we're gonna have to talk about as we go through the bill,
Yeah.
what that cost of care means, and it is in the report. And I'm looking around the room, so we'll have that conversation. So Katie,
Can I ask one question?
oh, yeah,
Careful clarification. So the RAND report, the average cost was 28,000 per child. The cost from 0 to 2 is 38,000 per child. It's two-year period. So to get the 28,000, basically, it's just the average. It's got the lower cost. I just want to make sure. I hadn't heard that the 38,000 never resonated before.
The cost per kid is different by age. So
Yeah,
28.
I never heard the 38,000. It's just a bit of a jolt.
it is a goal.
Huh?
Yeah. Huge goal.
Something like that. Yeah.
And then you think about trying to save for college. Okay.
It's awesome.
That's why we need to have a model of deduction for our adjusted gross income.
Need a better economy.
Yeah. Okay, that's not our job.
Can't do that, then it's all.
Well, okay, Katie, what? We all want a better economy. So stop at governance, and you know what, I'm wondering, maybe just go with me here. Would you like to go back and look at some of what's in the bill regarding CCFAP right now, since we've just been loaded up with all this, and then, and we'll go through as expeditiously as possible, and then we'll move on into the places there. Okay, Katie?
That's fine, it's logging to Zoom, pull it up.
Well, if we want people to work, we gotta provide some child care. So we are, let's go right back to the top. We have the list that you brought us. And it's good to go. Can we do something? When we have a conversation about total cost of care, can we dive into that section of the bill, especially since Nolan is here? And I know there are others interested. I know Katerina and Miranda and Sarah, you're here as well. And then we have the RAND report regarding total cost of care. What page is that on?
section 5.
Yep.
So
Page
this is,
5,
the payment to providers is where this is included.
yes.
And this would take effect, just so on the same page, this particular section would take effect 1 year out, so July 1, 2024 is currently drafted. Can you hear me okay? I know the math makes it so tricky. Am I loud?
Just project.
I know,
you can.
Okay, so right now, the bill is drafted, says that payments established under this section shall reflect the total cost of care. And then it says including, and we know including means including but not limited to.
Yeah.
Including whether the provider operates a licensed childcare facility or registered family childcare home, type of service provided, cost of providing service, and provider credentials. And then we say that the payment shall be based on enrollment and the professional standard established in a previous section.
So, I went back and opened up the report, the RAND report, and looked at page 77, where they have a list in the table, actually 2 tables related to with staff, that has staff structure, more of that for a minute, but that's looking at the cost of care includes things like professional development, classroom materials, meals, and kitchen supplies, transportation, if any, occupancy, so the rent, the lease, utilities, the insurance, the maintenance of the building per square foot, and then other operating costs, office equipment, medical supplies, and the biggest one is telephone and internet, audit and legal fees, fees and permits, licensing, accreditation. So, and then professional memberships. So the cost of care in 2022 dollars are listed there. The question is, in our bill, what does it say again?
Well, we have an including, so it's, again, including not limited to, so it could be any number of those things you just listed, but specifically called out are whether the provider operates a licensed childcare facility or registered family childcare home, type of service provided, the cost of providing the service, and provider credentials. So when we went through that checklist yesterday, one of my questions for you was, do you want to have just a definition of total cost of care instead of this including list? Just say it will reflect the total cost of care, period, and then have a sentence as used in this section, total cost of care means.
That, having it be definitive, at least initially, makes a whole lot of sense. At least to me. And then there will, more than likely, there could be an evolution of this definition going forward. But I think it needs to be somewhat definitive if we're going to understand the total cost. So, and I'm looking behind you, and I'm looking at Miranda, and I'm also looking at Sarah, because I know you two have been very much involved in a lot of this thinking. If you have any thoughts to add, Sarah?
I don't know what the department thinks, but I think the way this has worked in other states that have done these cost of care models is that there is an entity that it's not detailed in statute, but that there's an entity that's named, in your case, it's DCF working with Building Bright Futures or others, to figure out what are the proper elements to include in a cost of care model. And the reason I think to maybe not delineate it specifically in statute is that those might change over the coming years, right? And so it's easier to update those through a rulemaking process or a guidance document or some other system than to have to come back and change the law every time. So if there's some, evolution in quality that happens, as is already happening with the STAR system, right? Like if there's some thing that adjusts, it makes more sense to have a process whereby the folks who are immersed in that can come back and say, this is how it needs to be adjusted. And then a rulemaking process allows you all to see that as well, but it doesn't require actual a full statutory change every time. That's how it's worked in other places.
Okay, that does make some sense. Miranda,
I agree. I think we have, as Sarah mentioned, learned a valuable lesson with our stars of having things so prescriptive. And I feel like having the ability to, I'll do this. 'Cause I think
yeah,
I was gonna say, I agree with what Sarah was saying, is having it really prescriptive here in statute does make it challenging to be able to come into like the new, whatever's best quality, what should be included to be able to pivot. And that is a lesson that we are learning with our stars. It's so prescriptive right now that it's making it challenging to be able to make
so the way it's written in the bill really corresponds with what each of you are saying.
And when we had recommended also including the Vermont Association for the Education of Young Children in that process,
Yeah,
they're the ones who are currently doing the work on the compensation standards, which is one of the biggest components.
That would be-
there, so.
I would, as a point of correction, that is not the way it's set up in the bill. If you want a rulemaking process for total cost of care, you need to write that in.
I don't know, it says by rule there, but do we want rulemaking for this? Is this more of a guidance? This is,
The reference to rule is developing the compensation pay scale. So those are two different pieces.
okay, oh, thank you.
Yeah, I think we should make sure that they're both done,
Same way?
but yeah, because they're totally interactive too, and where's the compensation?
The rulemaking piece.
Yeah, the rulemaking.
Page 6 of the amendment. It says the commissioner shall amend the rule containing the payment schedule required by this section to account for inflation. The commissioner shall ensure that the payment schedule is posted to the department of
That
state.
would be.
Oh, okay.
And rule is mentioned first, the payment schedule by rule on page 5. That's what I was looking at.
Yeah. I think maybe just clarifying the whole process, that first, that we need to establish the payment schedule and then the total cost of care, and that if we're changing the payment, if we're changing the salary schedule, then that would change the total cost of care.
Mhm.
And so,
Are you proposing like a tiered timeline?
Yeah.
So that the,
except for that, I suppose until we have the compensation schedule, we still have to have the total cost of care before we change. But it depends on if we want to implement them both at the same time and like start the total cost of care when we get the salary schedule, or start the total cost of care first and then change the salary schedule and then change it again.
Yeah, I'm thinking that and putting another piece in there is moving CCPAD. So I think first, let's decide that we'd like to have the process that we just talked about, ECF, BASI, and Bright Futures working on total cost of care analysis. That will be dependent on the pay scale. So we're also going to have to talk about how that pay scale development takes place. So we'll get to that. So when we have that, then total cost of care can go together. So it does demand, I think, that can this happen, all of this happen by 2024 for implementation of 2024 budget? There's a short answer to that. It's either yes or no.
No.
Okay, so there's a no, and then no.
Can I throw out a crazy idea?
Yeah, please.
Why separate them? Why not just have one
Well,
group looking at?
No,
one?
I'm not separating. I'm saying that you can't do all this
I'm just saying,
before.
you put it together, the salaries and the total cost of care together and not a separate process.
Well, the people who are gonna be able to set the salaries are different than the people who are gonna be setting the cost of care. And just on that point, can I clarify, sorry to point at you with my pen. Did you, when you mentioned BASI, did you mean for the total cost of care or the salary? Yeah, that's what I thought.
About the compensation.
Yeah.
part.
Exactly, so VC is relevant to compensation, as are the public school people, as are, I think, Department of Labor. Because they're more used to doing sort of a salary
Yeah.
compensation analysis than AHS is. And then,
And AOE.
and
Did you say AOE?
yeah,
Yeah.
the public school, so AOE, DOL, and maybe VC.
And they
And Building Bright Futures.
Yeah.
And then for the total cost of care, and I'm just thinking out loud here, is AHS/CDD, and Building Bright Futures, and,
My thinking is, I think, yeah, so, yes, you're right. Then there's there's a section here for that. So my question, and I think it's your question as well, is do we put all those people together and say, figure it out and bring us back one package? Or do we separate out the groups and say, you go figure this out, you figure this out, and then come back together? Frankly, however those two groups want to do it is fine with me, but it probably may make some sense to.
and I think Miranda had, sorry, our deputy commissioner had a point of
Oh, yes. it is-
not, like, they're doing the payments, they shouldn't also be doing the,
Right, the
salary
box should
schedule.
not be in the head.
yeah, so I think separating it out and having the experts who understand salary and pay scale type stuff do that, and then the total cost of care, and then CDD is doing the
That makes a
payments.
lot of sense. Okay, so do you understand what we just said?
I do. And so it's the idea that both of these would go through a rulemaking process?
Let's talk, well, that's, okay, so as long as you have the two groups and what they're doing, that's good. And it's not going to happen for 2024, but it will, we should have a date certain by which we get this information back. So it could happen for 2025. So what is the date that we're looking at for this? Is it December 2023? Or is it later?
I think it depends what work product you want back. Are you asking these two different groups to come back and make a proposal that you're going to look at next session? Or are you telling them to go forth and do it, and once you come up with it, go through a rulemaking process? Or
Well, is it a guidance document? Okay, you're right. We have to go back and discuss if it's a rule or if it's not guidance. I'm not sure I'm interested in having a compensation plan go through rulemaking. That would probably not. That would be an interesting LPAR meeting.
Yeah, I mean, you're more
Yeah,
involved in the rulemaking process.
yes, and I'm also looking at the commissioner, deputy commissioner, around, would it make sense to have it be a guidance document, or how do we implement the compensation package once it's defined in this process? And so that is and then that also, what is that total cost of care? What role are you going to play in that? And then what role are we going to play in that? Yeah, no, it's pretty very, yeah. There are some big questions here. So, you have any thoughts now?
I just have one that I thought that I should share, is that I have looked at, I know other witnesses have given documentation, and I think we have, I appreciate the committee's understanding of why we would do both. I also haven't seen that the Child Development Division has the authority to tell private businesses what they must pay their employees. So that is a question that I have out to our federal partners to just understand, because I believe there's language in here that says contingent upon accepting CCFAP, you will pay your employees this. And my concern is that might be a disincentive for programs to accept CCFAP, which really harms all the families that we are currently supporting, and potentially those into the future. But I haven't seen in other examples of states that are doing something that those things are combined, that we are saying, you must pay these wages, and that's a part of the total cost of care.
Thank you for that.
You haven't seen, what haven't you, I'm sorry, just for clarifying, like what specific.
The compensation standard, that a compensation standard is a part of the total cost of care, because essentially, right, you are then telling these private businesses, like, you must pay an aide, but I'm just gonna make up a number, $15 an hour. Like, I'm not seeing that that is an example, like, in order to be able to accept CCFAP from the state.
Okay.
So although these two, as you were pointing out, are very intertwined in here, I'm not seeing in the examples, you know, in research that I have done, I'm not seeing, they certainly have interplay, but not in the same way that is being prescribed here.
So what are you seeing for other states defining total cost of care?
So they,
That's this.
there is that, right? So we have what RAND has and other states have done that. And I think what I'm seeing is that in terms of like compensation, is that is something that is outside of that total cost of care. So they have to have an assumption of what total cost of care is. But if you're talking about raising wages, that isn't that the state office is dictating to private businesses what they must pay. That is done in a different way.
So are they just assuming that as the payments increase to reflect total cost of care, that private childcare providers are going to pay more, or how are they addressing the salary, the low salaries for childcare providers?
What I've seen so far is a wage supplemental program, to be honest.
We love those. You love
Right,
those.
no, right. Which I said, like, all the
Just make it Miranda.
by a third party. By, yeah.
By a third party, oh.
Third party, I love it. Sarah, go ahead.
I just wanted to offer that Washington DC and New Mexico are two examples of places that have implemented the cost of care with a compensation scale, and the administering agency is implementing the compensation scale as a part of their administration of their state's versions of CCFAP, district and state versions of CCFAP. So those might be examples to look at of where it's working. And other states are working on how to do this now. But
As you're both talking here, it might make sense that when we get this information back, both on total cost of care and payment scale, that there is a recommendation as to how to implement the payments. That seems to be the most problematic, but both. I'm not sure we're gonna make that decision here. I think the goal would be to have it integrated as much as possible, but I am agreeing with you. It's a difficult place to be in right now and make that decision. So Katie, is there a way that we can add that in? It doesn't resolve the issue around guidance or rule, but I think we're going to have another step in here with the legislature, and it's possibly, I think for me, it could be as early as next January to look at this information and the recommendation, and then take another crack at it. I mean, I think we'll all love to come back to you. Seriously, it would be good. It would be fresh in the morning. Does that make sense? So we would get that recommendation that because we hear New Mexico and Washington DC have one thing, and other states might be doing it differently. But there's no reason why we can't run all of those races and do it the Vermont way. So, does that fit? I'm just looking at my committee here, okay?
I mean, I think we can have a sort of check back.
Gotta know what, I mean, it will be a very critical decision about how to implement the pay scale. I can think of it two ways. One, if the pay scale is going to influence the amount going out to childcare centers, then you need to ensure that the money is going to the employees. You ensure that the workers are getting that benefit. But if you don't have a system to that, then how do you know that's happening? So there's some steps.
I mean, it seems to me that the pay scale has, I think, needs to come first before the total cost of care, because that's
Well,
totally.
you know, we need to see them both, but I'm saying what we're gonna ask for in the bill is information from these two different groups. And we're going to ask for it as expeditiously as possible. I'm thinking either December 2023 or January 1st. Nobody likes to work on Christmas, on New Year's Eve, but January 2nd, 2024. That we have that information and we have recommendations about implementation as a guidance document. And then recommendations about any legislation necessary to put in place a pay scale or payment, anything that we need to do, and how it will be integrated. Because I think there are a couple other steps that might be involved. The DOL, as you said, they may help us with this. So, so I think there's just a little transition that we need in the bill.
This is making sense to you, Katie?
I would love to step back and sort of repeat what I think I'm hearing.
Yes, please.
I also want to flag that
And
you're,
I want Miranda and Sarah also to listen with us.
okay. I also want to flag that your introduction deadlines are earlier, the second year of the biennium. So if you plan to introduce a bill based on what you're asking for, you have to think about that deadline and maybe moving up when you want this information so you have a chance to digest it and draft a bill based on whatever is needed. So what I think,
October,
well, I don't know if that's possible, but your deadline, I'm not sure off the top of my head, but mid-November, early December.
yeah.
Okay,
You don't have, for committee bill, there's no deadline, right?
yeah, but potentially this could be really complex. So I'm
This
thinking
could
if
be.
you're drafting in January,
No, no, no.
I'm gonna be drafting this thing.
that's a heavy lift for January. Okay.
Shut down.
So what I think you're asking for is to have a report back in the fall, hopefully in the fall. And you're asking two different groups to do two different things. You're asking the group of DOL, BASI, AOE, Building Bright Futures to propose some type of compensation scale. What would that look like? You're having a separate group led by DCF look at what their proposal for what might be included in the total cost of care and what that might look like. In addition to those two pieces, you're having a third piece potentially coming from a group led by DCF as to whether and how to integrate the.
Not whether, how.
How? Well, I'm saying whether because I'm wondering if there are going to be any federal limitations on how to use the block grant money. So whether and how to integrate the pay scale and the total cost of care, and to also look at what New Mexico and DC, how they have done that.
Other states.
And other states, and then any recommendations for legislative action, maybe also how best to, that's the right word, how to implement that. Is it a
Yeah.
rulemaking, is it a guidance, what is the right mechanism for putting total cost of care and the pay scale into effect?
Yeah, I think I'm hearing it the same way you are in those groups. I'm having a moment of not having any seat at the table of the wage scale. Like understanding, we have said like we shouldn't, but then it also feels like if we have information that would be at the table, that also feels odd.
So we put you in consultation with,
And others, in consultation with.
so that you're not the primary leader of it, but they're still checking in with you.
I think that would, yes.
Okay. Well, I actually want to hear from DOL to see, because I say that DOL seems like the right, because they deal with labor and contract, wages and stuff, but I'm wondering if they'll come in and be like, we can't do this, we know nothing about child.
Well, you know, why don't we do that? Why don't we do this? Why don't we ask Katie to reach out to DOL regarding this? Is that something you can do? Or
I can.
Yeah.
I don't have any contacts at DOL because this is outside of my
Yeah. Is it
wheelhouse. I don't know
Harrington?
if you could
No,
Who is it?
I
identify.
think you want to talk to maybe Cameron Wood.
Okay.
Oh, Cameron Wood.
Okay.
Is it DOL? Okay. Come on, it's small.
And then if there's, if he thinks it's important to come in, we'll bring him in, or maybe he can just send us a note.
Okay, ask for something in writing.
Either way, fine. And then, this is good. I think this is helpful because this can get extremely complex and it's not something we're gonna resolve sitting around this table right now. But I think the enduring question is with regard to rulemaking. There might be some rules that need to be made in terms of establishing criteria for the work that gets done. But then the specific numbers and
It might be just guides.
guidelines, yeah, it's really more of a document that goes out. So that will be, so it's the distinction, the implementation would be the distinction between rulemaking and guidance document.
I wanted to answer Representative Weeks' question from yesterday. I started putting together an email, but since you're sort of on that topic,
Did you say representative?
She meant.
Oh, I'm sorry.
I didn't know if you were talking about somebody, I didn't hear who it was.
I spend a lot of time bouncing between different committee rooms. I apologize.
No,
Okay, so there was a question yesterday about where else state sets the compensation. So I sort of polled the legal staff to see what examples they could come up with. So, minimum wage was mentioned, but it's not really perfectly analogous because there's not any specificity about the job and the person's experience or the person's education. But then there was an example that the Department of Labor does a wage survey and comes up with minimum wages for different categories of construction workers that work on a state construction project. Apparently, this is called the Mini Davis-Bacon. I have no idea where that name comes from.
Davis-Bacon is the federal law.
Yeah,
Oh,
federal
okay.
law.
Same thing.
Thank you. Okay. And then if you're curious with the site, I can give that to you, but that's the only example that my colleagues were able to pull up.
So that would be an interesting conversation about how childcare workers work on this. No.
We're creating 2 working groups. You might want to have language in there that says DCF or somebody will provide administrative and technical assistance.
And coordinate the, yeah.
You need someone to schedule the meetings, but you also need, not to put it, work on DCF, but like, you're gonna want someone to run numbers.
Yeah.
And you're gonna want DCF probably to order
Why
data.
don't we actually have you do it?
No.
No, I think that probably for me was implicit, so, but I think it should be explicit in the language.
So you're not actually creating a working group though, because it's a little bit different. So there'll be one entity that's a state government entity that will take the lead, and everybody else will be working in collaboration or consultation.
Oh, okay, then you don't need the language then.
Yeah.
I
Okay.
wasn't clear to me if it was a-
But if there is an outside entity or an entity that doesn't usually run numbers for one of these, it should be called out.
Okay, this is good. Let's see what we got.
To your point, Katie, can your staff provide an example of this construction?
There, let's see, I
Something
got a
I'm really
link.
curious.
It looks like there's a report that comes out.
My sense, this is just my sense, is that the only way to, maybe there are other ways, but it seems to me that the way to guarantee pay scales is to make childcare a public service as opposed to a private service. And I'm really interested in this example that she's got to see how it's 100%. Just my sense is there's a legal challenge ahead here. But you have a number of working groups on wage scales and such. I think we need an analysis on the legality of establishing pay scales for private services. I'm not saying, I'm not telling you, I'm not trying to
No, I understand.
telegraph
Yeah,
what I think overall, but I just think there's a huge challenge there. Maybe worthy of pursuing, but I just think it's something you have to pre-think, not just trip over a year from now.
So I think what we might do, as we're getting the information about total cost of care and compensation, because that will feed into any reimbursement or upfront payment to childcare centers, which we're already doing. But the other issue here that you asked me for is something that we can reach out to our legislative counsel or Attorney General's office, some legal advice about that. So I think that's a really good, we don't need to put that into statute necessarily, but it's something that we can do to understand the consequences of when the report comes back, and if we are deciding to, what's the pathway we can take. Could we declare child care public service? Interesting. Or can we reimburse ask private entities to meet the conditions of that compensation?
Senator, I think you make an excellent point, and that's actually was one of the driving forces behind the expansion of pre-K in public schools, because then it would be a public service. It would be within the context of public education, and those salaries of those educators are bargained in a public process, and therefore it's much easier to ensure that they're paid a decent wage, and it's within an already established system. And I think there are ways, and so that was the pre-K part of the bill was a lot. That was one of the reasons why it was proposed. And you're on the education committee, so I hope you take note of that, because it does make the whole compensation part of it easier to implement. And then there are ways to expand beyond that to cover more children. And I do think there are also ways to figure out how to make it slowly become more of a public system rather than a private system. And I would be happy to chat with you more about that and how we could do that. And that was one of the driving factors behind that part of the bill, which unfortunately has been removed from the package.
Right, we thoroughly understand that. The issue then becomes, where is the money raised? How is it raised? And who pays for it? Does all of this stay under the umbrella of property tax? Or is there some combination that we can look at going forward? So, I think we're stepping into a really neat area where we can ask the questions that you're asking. And you can ask some of these questions in education. Ultimately, the financing of it. All going to be under education property or taxes and supplemented through general fund, or is it going to be some other system here that is integrating what we have now for both? Really neat question. But this set of studies, and the question that you're answering, that we can get response from legal counsel, possibly AG's office. I don't know who to ask this question. Would it be Damien?
I'm gonna start with Damien.
Yeah.
Yeah, this is his subject area, but I have a note, I will reach out to him and see if he has initial thoughts that he can share. I'm guessing he's probably more well versed in this topic and might have something already prepared.
It doesn't change what we're doing in the bill right now, but it will very much influence the decision to make moving forward. Okay. Do you feel like you've got enough there on that?
Have a little piece to start working on, so
That's good.
I will get started on that.
All right.
I'm
feeling good about that.
Stairs.
I'm feeling very good about that. So then we're gonna take a break, but then the issue of the CCFAP issue we'll come back to, and tomorrow, what time are we starting on this one tomorrow? 8:45, perfect, so we'll come back and we'll try to get into this ASAP. Okay. And go through it and make further decisions. I did want us to note that we have a letter from Vermont Medical Society on the governance structure with respect to maternal and child health. And so that's another place where I think we're going to be looking at some modification of the bill so that we know that the governance structure will work, and then we're going to need some transition language to help the agency go through whatever changes are being made. So that's another section we'll look at. Read the letter that's about DOH and maternal child health. So, question?
No, I saw that this morning. Thank you for forwarding.
Okay. So now what we're going to do is take a little